Good morning, everyone. I want to thank you for coming to our first Food is Medicine event. My name is Charles Platkin, and I'm the founder and director of the Center for Food is Medicine. The Center for Food is Medicine is an international nonprofit working to bridge the gap between traditional medicine and the use of food as medicine in the prevention, treatment, and management of disease, while also increasing access to these treatments, creating a more equitable food system that will improve health outcomes. We're very, very fortunate to have several experts join us today to discuss ultra-processed foods. Our panelists include Dr. Kevin Hall, the NIH Chief of the Integrative Physiology Section in the Laboratory of Biological Modeling at the National Institute of Diabetes and Digestive and Kidney Diseases. Dr. Marion, the Paulette Goddard Professor of Nutrition, Food Studies, and Public Health, Emerita at New York University, editor of foodpolitics.com, and author of at least 11 books that I know about. And Dr. Fang Zhang, the Neely Family Professor and the Interim Chair of the Division of Nutrition of Epidemiology and Data Science at Tufts University's Friedman School of Nutrition, Science, and Policy. We're so appreciative of you all taking time out of your very busy schedules to be here today. Since we only have an hour, I'd like to jump right into our discussion, which is why people came today. So what is the impact of ultra-processed foods on the risk of disease? And there are several studies that show that there's a higher risk of all-cause mortality. And what does ultra-processed foods do to us, and why should we be paying attention to it? We'll start and open it right up to the panelists.
Which one of us do you want to answer that
question? Well, Kevin, why don't you answer first, since you just did a study, and then Fang, you did a study. So why don't we all chime in? Kevin first.
Sure. So my particular interest has been in obesity, and the association between consumption of ultra-processed foods and obesity has been demonstrated in these observational cohort studies over and over and over again. And of course, those are associations. And of course, when they all point to the same direction, there's probably some fire underneath that smoke. And so I've been very interested in trying to understand what the mechanisms underlying that association are. Are they causal? Is there something special about these foods that's driving people to overeat, for example? That's where my primary interest is. And of course, the obesity is associated with a whole host of downstream diseases like type 2 diabetes, cardiovascular disease, various forms of cancer. And so another potential thing that I'm interested in is how much of the association between ultra-processed foods and the variety of other deleterious health disorders that we see in association is downstream of obesity versus independent pathways.
Thanks. Fang.
I can maybe speak from the epidemiological evidence. There are about 12 to 15 large-scale prospective cohort studies published in the last 3 to 4 years that reported findings quite consistently that a higher consumption of ultra-processed food was associated with higher risk of all-cause mortality. And these studies were conducted in populations in different countries, including United States, Canada, United Kingdom, France, Italy, and Spain. And the magnitude of association comparing the highest to the lowest category of consumption ranged from 30% increased risk to 60% increased risk of all-cause mortality. And the studies look at the dose-response relationship, reported about each 10% increase in ultra-processed food consumption was associated with a 15% increased risk of all-cause mortality. And other than all-cause mortality, and there are several cohort studies also reported a high risk of mortality due to cardiovascular disease or high risk of developing cardiovascular disease risk factors, such as Kevin mentioned, overweight, obesity, and also type 2 diabetes, hypertension. And these studies also are quite consistent in terms of the evidence. There are also studies reported positive link between ultra-processed food and cancer risk mortality, including the overall cancer risk and the risk of specific cancers, such as colorectal cancer. And evidence reported are positive link between ultra-processed food consumption and risk of liver disease, inflammatory bowel disease, anxiety, depression, dementia. However, these evidence, I would say, on these outcomes are still limited as of now. Although the body evidence is growing, and I think there are consistent findings to suggest ultra-processed food consumption contributes to premature death and poor cardiometabolic health outcomes.
Dr. Nestle?
Yes. First of all, we have to say what we're talking about here. The concept of ultra-processed foods is something that was only defined in 2009 by Carlos Monteiro, a professor of public health at the University of São Paulo in Brazil. And he defined ultra-processed foods specifically. Oh, I'm going to give an operating definition that's really easy. They're foods you can't make in your home kitchen because they require machinery and ingredients that you can't get in normal grocery stores. So if you can make it in your home kitchen, it's not ultra processed. If you can't, it is. And I asked Carlos recently if he knew how many studies had been done on ultra processed foods, and he sent me a slide showing that since 2009 he's recorded more than 1,600 studies with the word ultra processed in the title, virtually all of them demonstrating that large amounts of ultra-processed foods lead to obesity, type 2 diabetes, heart disease, cancers. Now it's depression and various kinds of neurological problems and overall mortality. These are all associations. They're not demonstrating causality. And for causality, we have to go to Kevin Hall, who has done what I think I like. I like hyperbole. I'm sorry, I like it. I think it's the most important nutrition study done since vitamins. And Kevin, you need to talk about your study and say what it is and what you found.
Sure, I'd be happy to. So I came at this question a little bit differently than many other people. I'm a physicist by training. I'm a reductionist. That's my sort of innate nature. And I've been studying nutrients for most of my career, trying to understand how the body adapts to different changes in macronutrients like carbs and sugar and fat and those sorts of things. And when I heard about Carlos's definition of foods, which basically ignores nutrients, says nutrients aren't the most important thing when it comes to health, it's really about the extent and purpose of processing of foods, I thought it was nonsense. It didn't make any sense to me. And when I kind of, this was introduced to me by another group of people from Brazil, and they said that they were using the NOVA system and they were finding these associations with obesity. And since I'm an obesity scientist, I asked, well, what is it that you think is driving this causally? And they said, well, it's probably because these foods are high in salt, sugar, and fat and low in fiber. And my kind of gut reaction was, well, you just named a bunch of nutrients. So is it the nutrients or is it not the nutrients? And so we designed a study to try to get at that question. And so we brought in 20 men and women to the NIH Clinical Center here where I work. They stayed with us 24 hours a day, 7 days a week for a month. And these really talented chefs and dietitians in the nutrition department took up this crazy idea that I had, which was to design 2 diets that were matched for these nutrients of concern. But one diet came from 80% of calories came from ultra processed food. The other diet came from 0% ultra processed food, 80% from minimally processed whole foods. And these diets were designed, again, to match for the number of calories that we presented to people, the carbs, the fat, the sugar, the salt, as well as the overall energy density, as well as the glycemic load. So matching for as many of the factors that folks from a nutritional background have always thought of as being, the bad guys, these 2 diets would be matched more or less what most Americans would eat. And these folks were given very simple instructions. They were told, this isn't a weight loss study. It's not a weight gain study. We're just interested in how these diets affect your health. Please just eat as much or as little as possible. And they were blinded to all their measurements. They were blinded to their weights. They were wearing loose-fitting scrubs, so they couldn't figure out if their clothes were getting tighter or looser. And, if I was right that this was really about the nutrients, then there shouldn't be much difference between what happened to these folks on these diets, because the nutrients were matched in these 2 overall dietary patterns. But I was wrong. And what ended up happening was that when people were on the ultra processed diet, I should point out that everybody got the same 2 diets. They just swapped in random order, 2 weeks each. So if you were first started the study on the ultra processed diet, after 2 weeks, you swap to the unprocessed diet and vice versa. And what we found was that people on the ultra-processed diet consumed 500 calories per day over the 2 weeks, consistently over what they ate on the unprocessed diet. They gained weight spontaneously, they gained body fat spontaneously, and when the same people were on the minimally processed diet with 0% of calories from ultra-processed foods, they spontaneously lost weight and lost body fat. And so that really kind of showed to us that there's potentially something about these foods over and above the typical focus on the overall, nutrient composition that I was kind of coming into the study thinking was the main driver.
Can I just make one comment about that? And that is that an average of 500 calories more is an enormous finding. Absolutely enormous. Most studies that compare one diet to another find a difference of 50 calories and they think they've done a really fabulous job. 500 is enormous. 500 calories a day predicts a 1 pound a week weight gain, which is exactly what you found in that study. And so the big question, of course, scientifically is why? And you're working on that.
Yes.
I'm sorry, I'm tossing you all these softballs. But it's because I think your work is so important.
I appreciate it, Marion. And,
I'm your biggest fan. What can I say?
Well, maybe in terms of balance, I'll point out some of the limitations because, these folks we take over their food environment entirely. They have no access to outside food. They don't have to prepare the foods themselves. They don't have to buy them. So it's a very artificial environment, granted. And we don't know how long that effect is going to last, right? So clearly they're not going to maintain 500 calories per day for years at a time, right? So it's eventually going to equilibrate. The question is, how much weight will they have gained by the time that equilibrates? And that's something that, of course, we don't know the answer. We can speculate with mathematical modeling or something like that. But those are the kinds of things that we don't know. Now, the question was, what is it about the diets that we actually gave to people that caused this difference in 500 calories per day, even under the limitations of our current experiment? And we can go into our current study that's ongoing, but, maybe we can take a step back and wrap that up at the end or something like that. If people, I don't want to dominate this conversation.
Well, I do. And I just want to say one more thing. And that is, you're talking about the fact that you're keeping them in a controlled environment as a limitation. I see it as an enormous strength of the study because most dietary studies are done on free living people and you can't control what they're eating. And if you ask them what they eat, they lie, or they can't remember. Let me put it more politely. They can't remember. I can't remember what I ate yesterday. I wouldn't expect anybody else to either. And here you have them in a totally controlled environment where they can't cheat. They can't lie. Nobody can sneak them food in the middle of the night, presumably. And so this is a controlled study in a way that no other dietary studies can be controlled. And it seems to me that that's an enormous strength of it. And it's part of why I think the study is so important, even though it's only a small number of people and it's only for a short length of time. It was spectacular results for something that was so short.
Yeah, and I think that on its own, it would this questions of generalizability would be, does this really represent what happens in real people? But like Fang said, we have this other mountain of observational cohort data, which does show this association between high intake of ultra processed foods and risk of overweight and obesity. So I think that by triangulating the evidence from these highly controlled studies, like Marion said, we conduct, to these naturalistic, people going about their day-to-day life and reporting, albeit with some error, but, there's no evidence that there's a bias in their estimate of ultra-processed food. It seems to be that the evidence is triangulating and showing that there's a clear effect.
And how much ultra-processed foods are we eating, as a country? Does anybody have that information?
Yeah, we've done the analysis using the dietary data collected from the National Health Nutrition Examination Survey, NHANES, and we studied children aged 2 to 19 years old. Yes, 2/3 of the daily calories consumed by US children came from ultra-processed food. And
So just want to, before you, 2/3 of the United States children are eating ultra processed foods as 2/3 of their diet is ultra processed foods. Am I getting that right?
yeah, we're using calories. So 2/3 of the calories consumed from ultra-processed food. And for adult population, I think the percentage is about 57. So it's still a lot among both children and adults in this country.
So we've kind of figured out that, the ultra processed foods are definitely dangerous to your health. And secondly, that almost 60% or more are consuming ultra processed foods. As part of their diet, 60% of their calories are coming from ultra processed foods on a regular basis. Right. So it's certainly significant. And one of the things that, Kevin, not to keep going back to you, but I noticed this fact and I want to make sure it's clear that we eat almost 60% of our calories per minute with ultra processed food. What was that? What was that definition? What was that?
Oh, so yeah. So what we ended up doing was going back into our data and trying to just sort of explore and figure out, what was different between how people were behaving when they were eating the ultra processed diet versus the minimally processed diet. And there's a couple of things that are important to note is that one of the things that was quite different between the two diets, because we were trying to match for the overall amount of fiber that people were eating, because it's very high to get a modest amount of fiber in an ultra processed diet without consuming fiber supplements. So we ended up giving people soluble fiber supplements. And in doing that, we gave them many very low calorie beverages, lemonade, basically Crystal Light lemonade. And so one of the things that we did was we asked how quickly were people eating these meals? And it turned out that during the ultra processed meals, people were eating faster in terms of grams per minute and calories per minute. Interestingly, when we took out the beverages, and some people think that beverages in some way don't count towards our appetite control mechanisms, although there's a lot of debate about that. When we took those out of the equation, it turned out that people ate the ultra processed meals, the foods, more slowly. Which is kind of interesting. But in terms of still calories per minute, because beverages have very few calories per gram, they still ate more calories per minute. So one of the questions is, what is it about the ultra processed foods that gives rise to more calories per gram? Because after all, we matched for the macronutrients, the salt, the sugar, the fat, the carbs, the protein. We often think of high energy dense foods as being high in fat because fat has more than double the number of calories per gram. But these foods were matched on that basis. And it turns out that they just have much, much less water on purpose. So when you make ultra processed foods, one of the things you're going for is extended shelf life. And what you want to do is you want to extract as much water from the food as you possibly can. And so that increases the energy density, the number of calories per bite, so to speak, much more than you would think with just the macronutrient composition. So while we're focused on things on the nutrition facts panel, like the sugar and the fat and even the fiber, what we don't often think about is just what the mass of the food is in itself. And if a lot of the water has been extracted because the food matrix is broken down in the processing of the food, then a lot of that water disappears. And what you end up with is a concentrated bite of food that has many more calories per gram.
Yeah, that's so interesting because when the Brazilians talk about ultra processed foods, one of the points that they make is that these foods are deliberately formulated to be profitable. And one of the ways you make foods profitable is by giving them a long shelf life. And so that would be quite consistent with what they say is the purpose.
So it's interesting about that because, again, that seemed to be the reasoning initially, and you would know this better than anybody, Marion, is that is to get longer shelf life and more sustainable foods out there to the public. But it's become sort of this, like Michael Moss talks about, this engineering it so that our taste buds are excited in such a way that it makes us want to crave these foods more than any other food. And correct me if I'm wrong or I'm getting this, you know.
Yeah, I mean, he and others would argue that these foods are formulated deliberately to be addictive. I'm not comfortable using the word
Not
addictive for food because we have to eat to live. And it's a question of which foods and what choices are made. But there's, there's an increasing amount of evidence for addictive-like behaviors around these foods. Where people eat, there's the famous Frito-Lay, or it was a Lay's potato chip commercial, where you can't eat just one. And that's the whole point, is that you can't stop eating them. And one friend of mine explained it as, when you got a salad in front of you, enough salad is enough. You stop eating it. But if you've got a box of potato chips in front of you, or a box of Oreo cookies or something like that, you can't stop eating them. They just go down really easily. And I don't know whether you picked that up, Fang, in your research, whether that picked that up, that kind of behavior, that people just love eating these foods.
Yeah, I certainly also heard about the not from my own research, but from others, that the how these ultra processed foods that in the food processing try to mimic the sensory qualities of ultra processed unprocessed or minimal processed food that could make it addictive. I know that you don't want to use that word, but this is what some of the research have reported, and people cannot stop eating this food. Also related to the additives being added to the ultra processed food, that artificial sweeteners, for example, or emulsifiers that put the foods together and mimic the taste, could be like the fat. But when we taste them, it sends a signal to our body that it's disruptive, and we don't sense that. And that could be potentially the reason that causing the addictive, like eating behaviors related to ultra processed food.
Question. So we talked about ultra processed foods, and I didn't vet this very well, but I saw a lot about fake meats, right? Which are sort of the rage right now, especially with plant-based thinking going on, which is I'm very happy about in many ways, but natural plant-based foods, and even 10 years ago when I worked with vegans and vegetarians, I noticed that their refrigerators were filled with imitation foods, which is sort of not what you would think. And I'm wondering if what you think about that, and they would certainly, I think, would be considered ultra processed foods according to the definition that you gave, Marion, correct?
Oh, there's no question that they're ultra processed. There's no question about it at all. Just take a look at the ingredient list. Whether they encourage people to eat more, is the jury is still out on all of that. These foods are not widely consumed. There are big questions about market issues and other kinds of things. I would say the jury is out on almost every aspect of the artificial meats, or the plant-based meats, or the cell-based meats. They're not on the market yet, really.
Right, but the whole idea of replacing meat, and again, I'm not putting any opinion out there, with fake meat is probably not the best idea given the information about ultra processed foods. I just, as a conclusion,
I don't know if I would go there. I think one of the things that's very interesting is, we find ourselves in this very interesting situation, right? Where we have the majority of the calories in our food supply come from this category of ultra processed foods in the US, in the UK, and Canada, Australia. And we have, it's a very blunt tool, right? This idea of classifying food as ultra processed, and it's on purpose completely complementary to a nutrition focus, right? It doesn't discuss nutrients at all. And so one of the questions I think that is open is, even if we can find these associations and we can find aspects of ultra processed foods that do drive overeating and eventually obesity, what is it about these foods? And is it all ultra processed foods, or is it subcategories that are particularly bad for us? And until we understand the mechanisms by which ultra processed foods drive obesity, drive these various other diseases, I don't think we're going to know how to make that subcategorization. kind of reversing at a population level in these industrialized countries that have already experienced this, dramatic rise in the amount of ultra processed food. Just making blanket advice to avoid ultra processed foods without knowing more about the mechanism, I think that's a difficult thing to do correctly or without unintended consequences. And so when you make a blanket statement like, oh, well, we should recommend that people just eat more beef and avoid, plant-based alternatives, well, we got to realize that there are downsides for that recommendation as well as upsides, right? So I think we're in a particularly precarious time with ultra processed foods because there's, the signal in the noise is increasing. There's more and more of these cohort studies that are ongoing. There's still only one randomized controlled trial, and we're doing a follow-up one right now to try to figure out what the mechanisms might be for overeating. And until we can figure out what those mechanisms are, I'm very uncomfortable giving people advice, especially at a policy level or at a population level, about what they should do to the food supply, how they should regulate, how they should introduce policies, tackling 60% of the food supply, which many people rely on because there's a lot of good things about ultra processed foods. One of the reasons for the long shelf life is to improve food safety. The foods are tasty. We want our foods to be tasty. We don't want to have to mean that we have to overeat them. But we also want our food to be relatively inexpensive, easy to prepare. We don't want somebody tied to the kitchen for 40 hours a week just preparing food. I think there's lots of positive things about ultra processed food. And if we understand the mechanisms by which they drive disease, then I think we'd be in a much better place to make recommendations to both people and policies.
No, but that could take forever. I'm just being honest here. That could take, at some point, I've been doing this a long time, for 20 plus years, not as long as some of you, but I just think I look at that and I go, we know, it's funny because we're doing this. I'm working on a book now on food as medicine and looking at evidence and everything else. And one of the things one of the categories that we have is the smell test, right? If it doesn't smell right, shouldn't you we have to give some advice, and maybe you can't do it in a governmental capacity. But as advocates, we have to come out there and say, hey, avoid ultra processed foods. There's something wrong here. This smell test doesn't work. And these are questions, they're not statements. I just want to, put that out there.
Yeah. I guess sorry. What I'm seeing, I'm kind of stuck in the middle because I see the advocacy side. I also see the pushback from primarily nutrition scientists and food scientists on the other side. They're saying, there's nothing to see here. What I see precious little call for is, really robust funding to try to figure out mechanisms. If people on either side were really serious about addressing this, they would say, okay, well, let's figure this out. Let's devote X number of dollars of research in a focused way to actually figure this out. And that would basically benefit both sides of this. But I see very little of that. I see a lot of people on one side.
Politics involved, no?
Sure there are.
Yeah. Sorry.
Yeah, I would like to, Kevin, I very much respect your work and I agree with totally the importance of understanding mechanism. And I think the research conduct fascinating. But I also want to just respectively argue that the evidence that move forward, the policy advances, right, doesn't only come from randomized control trials. And this is particularly true I feel, for nutrition, because our diet is so complex. Sometimes it's really hard, right, to isolate the impact of certain nutrients or a particular mechanism that could contribute to the chronic disease outcomes. So to me, right, with so many evidence, consistent, robust from large scale prospective cohort studies, should we do something about it? I feel that if we don't do it, we sort of could miss a great opportunity or important opportunity. Like poor diet is such an important contributor. Now it's surpassing, say, cigarette smoking, right, as the most important factor contribute to premature death in the US and globally. So I want to advocate to do something now, and would love to hear a lot of the work that also from you and from Marion, and the policy
Yeah, I think that there's subcategories where you actually can do something, right? Sugar sweetened beverages or beverages with a lot of added sugars. I think everybody agrees, whether they're ultra processed or not, are probably things that we can, they're the low hanging fruit, so to speak, on the policy agenda, right? But I guess the point is, I'm not even just talking about randomized controlled trials. I mean, there have been a few examples, even in observational cohort trials, where they actually go in and try to subcategorize with risk for type 2 diabetes, for example. There was a recent study that went into, I don't remember what cohort they looked at. Maybe you know this paper better than me, Fang. But they went back and they looked at, there's some subcategories of ultra processed foods that pose no risk for type 2 diabetes. And there's others that pose quite a high risk for type 2 diabetes. And I think that kind of information, along with randomized controlled trials, should go a long way, as opposed to taking 60% of the food supply and making a very blunt choice to do something about it. We should do something much more focused and much more relevant for people's day-to-day lives, as opposed to making blanket recommendations that are probably not likely to be adhered to by the vast majority of the population.
But they also, I think one of the things that we often do, and say we as public advocates, is we confuse the public by not being able to boil something down into advice, and we make it so complicated that everybody just goes, oh, whatever, I'm just going to do whatever I want and forget this nonsense. I'll die when I die. And I hear that a lot. So I guess what I think about from a policy perspective is, how do we impact people sooner than later? And they're not going to be able to develop the nuances, and boil things down. Like, if you can't make it in your kitchen, then don't eat it, right? And by the way, that's advice that I feel very comfortable giving out. When you look on the nutrition fact panel, if you can't make it in your kitchen, don't eat it. Okay, unless there's a couple of extra ingredients. And by the way, I eat chips. I eat, I eat crappy foods too. I try to minimize them and have 80% or 90% of my diet be from natural food, from whole foods, right? So I think it's part of the message that we're trying to send, right? So one question I have, sorry, Marion, go ahead.
Yeah, what makes me somewhat more comfortable about advising this is that ultra processed foods are, in a sense, a category of junk foods, and nutritionists have been advising against junk foods forever. Everybody knows what a junk food is. I mean, it doesn't. It's in a way, ultra processed is a slightly more polite way of putting it. And people would be healthier if they ate less junk food. I mean, I don't think there's much question about that.
Right.
So I think, and we're counting on you to do the science and explain all this.
Yeah, but I think counting on one person to do it in a very small randomized controlled trials is a big ask, right? So I think the point is that there's very few, but I think the point is that the cutting the cut point for an ultra processed food is pretty, there's a knife edge where people spend 90% of the debate on ultra processed food arguing about these edge cases, right? I get ultra processed lunches, frozen lunches, on a regular basis. They're high in vegetables. They have a bunch of legumes. They have a high whole grain content. It's just
Processed.
you look at the ingredients list, you can see that there are several ingredients that bind the food together in certain ways so that they can survive the microwaving process to make a very nutritious, from a nutritional standpoint, lunch with low in sugar and high in fiber and high in all the things that nutritionists have told us for decades and decades, but they count as ultra processed foods. And right. The point is that there are ways that we can improve the nutritional, we can improve nutrition for people, but we can't make it so that they have to make all this food in their home kitchen. We have to make easy, accessible foods that people can make with relatively little skill, inexpensively, that are extremely tasty, that can displace, the deleterious ultra processed foods that we have. And if we have this debate about, targeting the privileged folks who can, go into their backyard garden and prepare their whole food meals in their wonderful chef's kitchen at home, sure, those people will be great. I have no little problems recommending that they can avoid ultra processed foods all they want. The vast majority of the American population do not have that privilege. And what we need to do is we need to kind of figure out what the problems are about current ultra processed foods and make it so that we can provide easy access, affordable, tasty, convenient meals for people that have all of the things that we all agree on are good for health.
So a good segue to that. So I wrote this question. I'm reading it, but we can get it. What are the ethical implications and potential negative consequences of food companies reformulating their products to meet health guidelines in schools? And what action should be taken to address these concerns? So I've heard, and this is not like anecdotal. I mean, food companies will reformulate and create for ultra processed foods that meet guidelines for, let's say, New York City schools, because it's such a big audience, right? So, and that's kind of leads me to believe, like, if we find out, okay, what are the health implications here, and we can boil that down, then they could basically re-engineer their foods, and eliminate that one element that may be causing obesity or causing disease, and then now everything is hunky-dory, and I'm not so sure it is. But I think the way they're formulating their foods for schools, New York City schools specifically, is really something to consider and think about in ultra processed foods. Any comments on that?
I think we want to be careful about that, to reformulating the foods in order to meet certain nutrient requirements. Because I go back to, Kevin, your goal is to figure out what the mechanisms, is that the nutrients in the ultra processed food that played a role in contributing adverse health outcome, or is it processing itself, right? So I think until we can figure that out, I don't know whether we just simply meeting the nutrient requirement would be able to reduce the adverse outcomes such as childhood obesity.
Right. I think you're making my point, which is we need to understand the mechanisms before we can make such guidelines, right? But I think the point is, if we do understand the mechanisms and
No, we lost Kevin.
Lost your voice, Kevin.
Anyway, we'll move on from that. We didn't hear you, Kevin.
Yeah, can I say something? Can I say something about reformulated products?
Yeah. I was just saying.
Go ahead.
I was just saying.
I didn't hear you.
Sorry. I was just saying this is our government internet. Just.
Oh, dear.
I was just saying that if we actually do understand mechanisms, then re-engineering and reformulating, not just, I agree completely with you, Fang. It's not just about the nutrients, right? It's combinations of nutrients in specific ways. And until we understand what it is about those foods and what it is about healthful properties of foods that we can all agree on, if we could put those sorts of guidelines in place, then I'm all for re-engineering or reformulating foods. I think that if we really understood the mechanisms, we could do that effectively.
Yeah, I'm not. And for political reasons more than anything else, and marketing reasons. The food companies that produce products for schools formulate those products specifically to meet the school nutrient requirements. But they have the same brand name on them that the products that are sold outside of schools do. And the foods that are sold in schools send a message to kids. These are what you're supposed to eat. We're serving them in schools. This is what food is. This is what you're supposed to eat. And these products teach kids that branded products are what they're supposed to be eating, regardless of what the nutrient composition is, because they have the same brand on them. So this is about marketing. Food companies spend fortunes to get their products into schools, because if they get them into schools, they've developed a captive audience, and one that will think that their products are normal parts of the diet forever and ever.
Like Lunchables.
Lunchables.
Would you
Okay.
be if there
Very-
was a healthy version? I'm just an open question. If there was a healthy version and everybody agreed on it, but there was no branding, there was like basically it was just
Right.
sales to schools of unbranded.
Fine.
Okay, then we
But they
agree on
won't,
that.
they won't do that.
Okay. So I agree with you with the marketing problem. I completely agree about that. But I think, where I'm coming down is if we understood really what was it about foods that drove disease or sustained health, and we could actually make those guidelines for those purchases, I think that would be a benefit.
I do too. Who could possibly argue?
I would just question what we would consider healthy and what we would all agree on that would be comfortable, to serving to our kids, knowing and who's behind it and who's making that decision. So, I think that those are all, and also long-term outcomes and long-term studies that which are so difficult to do, as Fang had mentioned, and your study is so unusual that you did, and so unheard of in the nutrition space, or at least for me. I mean, maybe you guys have heard more of that, but it's hard to do that. What are you going to say?
Could she explain what her study is?
No, I was saying Kevin's study.
Kevin's study.
Yeah, I was saying Kevin's study. She had brought up that it's hard to do these research studies in a non.
I'm sorry. I thought you were talking about a study that she had done that I didn't know about. I wonder.
You did do a study on the impact of ultra processed foods and cancer.
Right. Yeah.
Yeah.
That's a cohort study. We look at
Yeah.
ultra processed food consumption and colorectal cancer risk.
Yeah, and what was your findings? Because I just to bring it back up.
Yeah, I think there's some interesting findings. Overall, we found our increased risk of colorectal cancer among those who consumed a high amount of ultra-processed food. These are 100,000 people, more than 100,000 of individuals swallowed for a long period of time. But interesting, only among men, not among women. That's one, I think, finding we saw. The other is, as Kevin, you also mentioned that in terms of different types of ultra-processed food. So this study gave us the availability sort of to look at different types of ultra-processed food. Overall, we saw an increased risk of colorectal cancer, but there are certain foods like yogurt that we found that yogurt consumption among women, those are ultra-processed food yogurt, right, among women was actually not related to increased risk. It was related to lower risk of colorectal cancer. So I think that we do need to also study more about different types of ultra-processed foods, right? And some could be our healthier version, like whole grain foods and yogurt, some yogurt dairy foods. Although I'm still worried about the sugars being added to say, breakfast cereals and yogurt, right? So I think some of the benefits that for these less harmful ultra-processed food might be offset if there are added sugars being added to these foods.
Right. And yeah, sorry.
One of the reasons why I wrote a book called Soda Politics was because sugar-sweetened beverages are, what did you call them, Kevin? Low-hanging fruit, or low-hanging fruit. It's the one thing that everybody can agree on, that everybody would be healthier drinking less sugary beverage. And I have a 500-page book that argues. It's how to get sodas out of schools and places like that.
So I wanted to talk about regulation and government intervention and policy for a moment. And I thought I saw this. I'm pretty sure I did. That France was trying to ban ultra processed foods. Did anybody see that? And it was shot down. Are there examples of countries? And again, I'll leave it to the experts, but Brazil, Peru, that are sort of regulating ultra processed foods. Could you guys talk about that? And is there anybody getting this right in terms of around the world, and in terms of promoting this correctly, and Kevin, with respect to what you were saying, that we're not sure what promoting it correctly is, but are there any countries that are getting it right, or communities that are getting it right about ultra processed foods that you can bring to our attention?
Yeah, the Latin American countries are leading the world on these kinds of things, but interestingly, they're doing it on nutrient grounds. So there are warning labels on food products that are high in salt, sugar, and fat, and calories. In Argentina, Brazil, Peru, Mexico, I'm Chile. And what's been interesting about these kinds of initiatives is they're all being studied pretty carefully, and they do show that people who can't read and children can recognize these products and reject them, and people are buying less of them. There has been enormous, overwhelming food industry pushback on these public health initiatives, to the point where in Chile, they've gotten the warning labels off a lot of products. They've been able to reformulate to sneak underneath the whatever the requirements are. And we're seeing major political battles across these countries, where the food industry is very concerned that warning labels on these foods are going to cause them to lose sales. And so this is a very political issue on many levels, not just the scientific level, but also on the marketing and operational levels.
Well, I had one question I did forget. Are there any specific ingredients that come up time and time again in the literature, in the scientific literature, that are sort of the most offenders, the biggest offenders in ultra processed foods, or not really yet, or we haven't really figured that out yet?
Well, it's still so, the way Carlos Montero puts it is that salt, sugar, and fat take care of 90 to 95% of ultra processed foods. They don't all have it, and adding salt, sugar, and fat does not automatically make a food ultra processed, but they tend to have combinations of these ingredients in very large amounts and
Right.
calories.
And do you have a sort of a secret theory that you go home and tell your family and friends, Kevin, about what's going on here?
Yeah, I mean, I alluded to one of them earlier, which is that these foods tend to be concentrated and high in calories per gram or per bite of food, the way to think about it. The other option is that it's not these individual nutrients like salt, sugar, and fat in it's potentially combinations that exceed certain thresholds. So for example, there are normally in nature, there are very few foods that are both high in sugar and high in fat, or high in salt and high in fat, or high in carbs and high in salt. And so a professor at University of Kansas named Tara Fazzino, when we published our paper, she had just come out with a new categorization system for labeling hyperpalatable foods as foods that exceeded these pairs of nutrients. So it wasn't just an individual nutrient, it was these pairs. And she asked us, did you present people with more foods that that were exceeding these threshold pairs that I just mentioned? And of course, at first, I didn't think that that would be possible because the overall diets were matched for salt and carbs and sugar and fat. But it turned out that when we went back to the individual foods that were put on the plate, we indeed, in the ultra processed diet, presented people with more individual foods that were exceeding these pairs of nutrient thresholds, mostly in fat and salt, actually. And so when we went back and analyzed our data, it turned out that these two factors, the energy density and the percentage of calories from hyperpalatable foods, those foods that cross these pairs of thresholds, they both mediated about 40% of the effect that we saw. And so our new study is designed to actually tease that apart. So we've reformulated two new ultra-processed diets, one that is high in energy density but low in hyperpalatable foods, and the other is low in energy density and low in hyperpalatable foods. And so we have 4 diets. They're all still matched for calories and carbs and fat and sugar and salt and protein and fiber. But we have varying levels of energy density and varying levels of hyperpalatable foods. And so the hope is that we'll be able to tease apart between energy density and hyperpalatable foods, which are the main drivers of excess food intake across a variety of different kinds of ultra-processed foods.
Yes. The journalist Tamar Haspel boils it down to, they taste good.
Yeah, but unprocessed diet tasted just as good. I think that's another aspect of our study that was really interesting, was that we didn't want people to be leaving our trial because they hated the food, right? So even in our minimally processed diet, when we asked people to rate, how pleasant were the meals, they rated them equally pleasant as the ultra processed diet. So, that doesn't eliminate any sort of food reward or hyper palatable kind of subconscious drive to consume calories, because that's a subconscious part of your motivation and incentive salience of food. But I think that it doesn't mean that the alternative has to be not tasty, right? And just because a food is tasty doesn't make it prone to overconsumption on its own. I think we need to better understand that.
Right. Interesting. And so back to policy. So what are your recommendations from a policy perspective around ultra processed foods? We started that in the beginning of the talk. We're coming to the tail end. We're at 10:20. We have 10 minutes left. And I guess, what would you advise to the general public? Kevin, and I'm paraphrasing, but I want to get this right, because would you say that just wait?
No, I mean, I think that we have to take people where they are, right? If you are one of the people who's concerned about this topic and has the privilege to be able to kind of replace ultra processed foods in your diet right now with minimally processed alternatives, and you have the time, or you can hire someone to kind of prepare those foods for you, then there's no downside to that. I don't see a downside other than it's probably going to cost you more money and it's going to cost you more time. But that's the downside. But when we have a population of people who rely on these foods, who don't have the equipment or the skill or the means to store the alternatives right now, and we don't have those healthy alternatives easily available that are convenient for folks, I think we have to be really careful when we give advice to those folks. They just don't have the same level of privilege as the folks who can actually make that switch and do it.
And just speaking for someone that would be listening to a webinar like this, I would be in my seat going, yeah, that's the whole idea. Give them access, give people food, give them healthy food, give them the equipment so that they can have the same privilege as everybody else.
But giving them a box of produce ain't going to cut it, right? You also have to give them you also have to give them the time and it's not as simple as just giving them the access.
No, we talk about that all the time. We do. And we do talk about that all the time. It's not just giving them fruits and vegetables and saying, hey, go get them. It's more about giving them, understanding lessons, making sure they have the proper equipment to cook, the pans, the whole thing.
Right.
Yeah, agreed. Sorry. So Marion, the same question for you, and then Fang.
Well, I think everything that there is to say about it has just been said, that it depends on who you're talking about. And, I want policies to change so that the healthy choice is not only the easy choice, but it's the cheaper choice. That requires an enormous change in the way our food system operates. And I have a whole laundry list of things I need to change. I tend to think about upstream policy changes, which go way, way, way beyond individual choice of foods. I want to see our agricultural system totally transformed into an agricultural system that promotes public health by focusing on food for people rather than feed for animals and fuel for automobiles, which is the way our food system is set up now. I want our election campaign laws changed so that people who don't have a lot of money can run, but have principles, can run for office. I'm interested in those kinds of policy changes. I think our food issues would be solved if people had a universal basic income and could buy their own food and weren't required to spend what little money they have on the most calories that they could get for that money. I think there are all kinds of things that we could do politically in our wealthy country that would make an enormous difference to people's lives. How about a healthcare system? Just for starters, I can think of a lot of things, but ultra processed foods, asking individuals to avoid ultra processed foods is as downstream a policy recommendation as you can make. it puts the burden of responsibility on individuals. And I think it's extremely difficult for individuals to fight the entire food system on their own. They need help. We should be giving them the help upstream. And I talk about these things realizing how absolutely ridiculous they sound from a political standpoint. But I think if you don't know where you're headed in policy, that the smaller policy issues that you're working on, you need to know where you're headed if you're going to decide what you're going to do on the downstream level. So I'm very interested that ultra-processed foods are in the dietary guidelines for discussion. I'm fascinated that the food industry has marshaled so much effort into fighting. They don't even want the dietary guidelines to mention the word, which they did not in the last version. And they would like it to stay that way. I think that's where the politics are, and I'm interested in politics, so I'm watching it with great interest.
Yeah, yeah, and I agree with all of the points that Kevin and Marion you said about it. And for many people, right, ultra processed food, maybe the only affordable foods, and eating the unprocessed or minimally processed foods is expensive, and you need the equipment to cook. You need the skill. People need the skills to prepare healthy meals. So I don't think we cannot stigmatize people who live with diet-related disease for consuming ultra-processed foods. So I think the government or the society, our government, our health care system need to act upon these. I would be advocating for the government to have regulations, to regulating the availability of ultra-processed food in certain environment, for example, schools. And I would love to see the labeling policies and limiting the marketing of ultra-processed foods. And we know that a lot of ultra-processed food are marketed to be healthy foods. And there's a lot of money spent in marketing of ultra-processed food. I think policies need to move forward in that direction. And I also think the healthcare system can play a larger role in integrating foods into healthcare, such as what we said about the food is medicine strategies. And these strategies involve our doctors prescribing foods and fruits, veggies, or other healthy foods to patients who are food insecure, nutrition insecure, and have diet-related diseases. So it's more, I totally agree, it's not our personal choice, it's more that our society need to act together, especially our government and our health care system can help together to address the diet-related chronic diseases, including what caused by ultra-processed foods.
And that was very well said. And I do agree that there should be labeling, and even if it's an advance warning and to what we discussed before, just saying, hey, this could be dangerous for your health. It's not, could be, right? Or maybe dangerous to your health until we have more definitive evidence. We're close to wrapping up. I like to always respect our audience and make sure that they get in on time and get out on time. We always start exactly at 9:30. We always end right on schedule. I just think that this was great. We probably scratched the surface of this, and I really appreciate all of your time. Do note that the Center for Food as Medicine puts out a weekly news and research digest, which Dr. Marion Nestle has also given me advice on, and I've tried to make it less intense. And we do scour and curate all the research and everything that's come out each week on food as medicine, whether it's treatment or anything related to the topic, and we take a broad approach. Sign up for our newsletter at foodmedcenter.org. This event was recorded and will be posted on our YouTube site. Each week we do extensive articles that are well researched and with academic rigor on our website. And I want to really, again, I know I said this several times, but thank you so much, Kevin, for coming, Marion, and Fang. I really appreciate your time, and I think this was hopefully painless. The pain was on my end on the preparation. We over prepare for everything, as you know. And also, if you go to our website, we did prepare an extensive document on ultra processed food, which has so many of the research studies, books, podcasts, all the news articles that have come out. It's right on the front page. If you just scroll down, you'll see it. It's ultra processed food. It's an everything resource guide. And it has links to everything. We don't do our own reporting, but we're curating what other people that are really expert in this community have done. And again, thank you all for coming today. I'll leave you with this. While diet has the potential to cause or prevent disease, it also has the capability of treating disease and building and maintaining and restoring health. And I want to thank you and have a great week. And again, thanks to our audience and our panelists. Take care.
Thank you.
Thank you.
Bye-bye.
Bye-bye.